All right. Well, welcome everyone. Thank you so much for joining us today for today's webinar. My name is Dr. Dana Hunter, and I serve as a research portfolio manager for Arizona State University, Office of Community Health Engagement and Resilience, and Global Center for Applied Health and Research. Our goal at OCHR is to co-create interventions with communities that focus on inherent strengths and assets that promote resiliency. We provide culturally relevant, trauma-informed trainings and resources for community health workers, or CHWs, and other health professionals that address toxic and traumatic stress for children, youth, and families. Just a little housekeeping before we get started. If you have any questions during our presentation today, please type them into the question box in your Zoom control panel. We will make sure that all of your questions get answered and asked and answered by the end of the presentation. For other comments, please use the chat function. We also have live Spanish language interpretation brought to you by the Tucson Language Justice Collective, and our two amazing interpreters today are Natalia and Maria. If you would like to use the Spanish channel, please click the interpretation button on the Zoom control panel at the bottom of your screen and select Spanish. And I think Natalia should be placing something in the chat box for you. Today, our webinar topic is mental health and trauma in housing insecure populations. Before we get started, we'd like to share a land acknowledgement. Arizona is home to 22 federally recognized tribes who've inhabited these lands for centuries. The state is comprised of approximately 1/3 designated tribal land. However, much more than that is indigenous ancestral land. Arizona State University acknowledges that our campuses are located on ancestral territories of indigenous peoples, including the Acamel, O'odham, Pima, and Peepash Maricopa Indian communities, whose care and keeping of these lands allows us to be here today. ASU acknowledges the sovereignty of these nations, and we honor the tribes who are not federally recognized but are integral to Arizona's past, present, and future. So to get us started today and to get us to just our wheels turning and thinking about the role and importance of mental health in general, we'd like for you to just take a brief minute and share in the chat one thing, place, or person that helps you feel safe or grounded. If you can, just begin to pop some of those thoughts in the chat for us. Beach, garden, nature, outdoors, animals. I see the beach again. Pets, water. Yes. Your home. Okay. All right. Hi. Prayer and walk in nature. Amazing, amazing. All of those are great thoughts and ideas. Thank you. I see you're continuing to put things in the chat. So these are different for each of us. So it's so important just to know what those things are, and we all get so busy, but just to take those moments, those critical moments throughout the day, and just pause and reflect and go to that place, whether it's in person or just even in our minds and thoughts. Okay, so thank you all for taking just a quick minute to share that with us. And now I have the pleasure of introducing our presenters for today. Beatrice Vega Luna is a program coordinator at Arizona State University's Global Center for Applied Health Research. With more than 16 years of experience in the implementation of substance prevention programs for parents and youth of the Latino community internationally, she's worked in the design of evidence-based research programs. Beatrice holds a master's degree in social work and a bachelor's degree in interdisciplinary studies with a concentration in communications and social work, both from ASU. And Zoe Somerville. Zoe is a program coordinator within ASU School of Social Work and a private practice therapist. Zoe has worked with housing insecure populations and public housing residents, providing resource navigation and equipping clients with the tools to advocate for safe and quality housing. As a therapist, Zoe supports clients in the identification of trauma symptoms and trauma processing. So at this time, it's my pleasure to turn it over to Zoe, who will kick us off with our presentation today. And thank you all again for being with us. Zoe.
Hello, everyone. Thank you so much for taking the time to join us today. So I'll get us started with some key terms. So when we talk about housing insecurity, it's defined as the state of having difficulty acquiring housing, having minimal control over one's housing, being at risk of losing housing, being uncertain about the tenure or how long you'll be able to live there, or living in housing that does not meet like basic household needs. When we talk about homelessness, the formal definition is a lack of a fixed, regular, and adequate nighttime residence. When we talk about affordable housing, the U.S. Department of Housing and Urban Development define it as like housing costs should not exceed 30% of household income. And then I wanted to talk about there's some discourse around referring to the population as unhoused versus homeless or person experiencing homelessness. So when we talk about using unhoused, it's an attempt to like shift the issue of homelessness onto like society. So acknowledging that it's more the fact of like there's not enough affordable housing or housing resources rather than like placing the blame on the individual. And then the argument also is that the term homelessness or homeless can be stigmatizing. So then there's also people that encourage us to shift towards person first language. So saying person experiencing homelessness. Some people critique the movement to shift this language because it's like we don't want to focus. They're concerned that we focus too much on the language of things and not enough doing things to actually help community members address like the issue of homelessness.
Hi everyone, welcome everyone. I'm going to talk a little about statistics. So according to the 2023-2024 annual homelessness report, the U.S. homelessness rose by 18%, affecting around 770,000 people across nearly all groups. So that includes families, youth, seniors, and people of color. Veterans were the only group to see a decline due to the target federal investment. The rise in homelessness in 2024 is largely due to the affordable housing crisis, stagnant wages, inflation, and the end of the pandemic era protection. Added pressure from climate events, immigration, and weak safety net also played a role. I will go deeper into those points shortly later in the presentation. Well, it's interesting to talk about the causes of rising homelessness in 2024. So let's start with the core issue. There is simply aren't enough affordable homes to go around, and the demand is growing, but supply is falling short. For example, in many cities like Los Angeles or New York, that's an example, waiting lists for affordable housing can be years long. Developers are building, yes, but often there's a luxury apartments, not units for working class families can afford. Now, combine that with this, wages have been mostly stagnant for years, while rents have skyrocketed. Imagine someone earning $15 an hour. That would be around $2,600 a month before taxes. In many cities, even a one-bedroom apartment costs over $1,800. That leaves barely anything for food, transportation, or healthcare. These people is living a paycheck by paycheck life. Then adding in a general inflation like groceries, gas, utilities, are more expensive than just a few years ago. Like a gallon of milk that used to cost $2.50 might now be over $4. Every dollar does not stretch as far, especially when rent takes the biggest bite. During the pandemic, programs like eviction moratoriums and rental assistance helped many stay in their homes. But those protections are gone now. Without them, many people who fell behind on rent are facing evictions with nowhere affordable to go. So when we talk about the affordable housing crisis, it's not just about buildings. It's about people being squeezed by rising costs, stagnant wages, and a lack of support. Solving it means addressing all of these pieces together. The next slide. So let's look at the growing impact of natural disasters events. Hurricanes, wildfires, and floods are happening more often, if you notice that, and with more intensity. When these events hit, they destroy homes and displace entire communities. But what happens next? Recovery support is often slow and uneven. For example, after Hurricane Ian in Florida, many low-income families have nowhere to go, and rebuilding efforts focus on wealthier areas first. That's the truth. So people are left stranded without the resources to recover or relocate safely. At the same time, immigration continues to rise, driven by conflict, economic hardship, and yes, climate change in other countries. Many cities are seeing growing numbers of newcomers but do not have enough infrastructure like housing, shelters, or social services to accommodate them. For instance, cities like Chicago and New York have seen a surge in asylum seekers, leading to overcrowded shelters and emergency housing in temporary spaces like police station or school gyms. And here's the big problem. Our social safety nets aren't built to handle this kind of pressure, to be true. Whatever is mental health service, rental assistance, or emergency shelters, the support systems are undefined and overstretched. So vulnerable groups like seniors, people with disabilities, or those working minimum wage jobs are left exposed. When disaster strikes or rent increase, this is often nowhere to turn for them. So what we're seeing is a perfect storm here. Climate events pushing people out, immigration adding new demand, and a safety net that is too thin to catch everyone. But if we want lasting solutions to the housing crisis, we need to invest not only in the homes, but in people, systems, and resiliency. Now let's talk about trauma and why it matters in conversation about housing, displacement, and social support. So according to the Substance Abuse and Mental Health Service Administration, or SAMHSA, trauma is defined an event, a series of events, or set of circumstances that is experienced by individuals as physically or emotionally harmful or life-threatening. And that has a lasting adverse effect on the functioning and mental, physical, social, emotional, or spiritual well-being. So let's take a look at what it is. First, trauma isn't just about what happens. It's about how it's experienced. What might seem small to one person could be the best devastating for another one. Second, trauma affects every part of life, not just mental health, but also relationships, physical health, and even a person's sense of identity or purpose in life. And finally, trauma has a long-term effect. It does not disappear when the event is over. It stays in the body and the mind unless there is a real support. So think about someone who lost their home in a fire, or a child growing up in a shelter, or a person escaping for violence or another country. These are not just logistical challenges. They are traumatic experiences that shape how people think and survive moving forward. Another definition that we have that I want to present to all of you is American Psychology Association, APA. Trauma is in a very human way. What it says, an emotional response to a terrible event like an accident, rape, or natural disaster. In short term, people often feel shock or on denial. In the long term, trauma can show up as a flashback, unpredictable emotions, trouble in a relationship, and even physical symptoms like headaches, nausea, or chronic fatigue. So there are normal responses to abnormal experiences. This line is critical because often when people struggle after trauma, they are told to go over it. But the truth is that when they're feeling, don't make any sense. Trauma rewires the brain. It changes how we see the world and how we see ourselves. So wherever someone has lost their home in a fire, survived abuse, or lived through war or displacement, their reactions are not signs of weakness. They are signs of survival. And if you want to build real solutions, whether it's housing, mental health, or public policy, we have to start by understanding the way people carry inside, not just what we see on the outside. Interesting to know that about 60% of men and 50% of women in America will experience trauma at least once in their lives. Within 12 million of US adults suffering from PTSD during any given time, given its prevalence, it is important to understand what trauma is, what effect it has, and crucially, where help can be found. When someone experiences trauma, whatever, from homelessness, loss of homes, or displacement, the impact goes far beyond the event itself. Trauma can affect every part of a person's life, like a difficult concentrating or remember things. It struggles in relationships, like feeling disconnected or misunderstood. Withdrawing socially, meaning that avoiding people, even loved ones. Feeling constantly afraid or sad, even when nothing seems wrong. Always being on the edge, like nervous, jumpy, hyper-aware of surroundings, irritability or even bursts of anger that seems out of character. Intrusive thoughts or flashbacks can bring the trauma back over and over. And perhaps hardest of all, feeling numb, like it is impossible to feel joy, love, or hope. This is what psychological and physiological distress look like. It is not always visible, but it's real. These reactions aren't signs of weakness. They are symptoms of a nervous system that is being overwhelmed. So wherever we are talking about housing, mental health service, or community support, understanding trauma means seeing the full picture of the people who carry that and why healing takes time, compassion, and the right kind of care. Important to know about signs of trauma. Trauma affects people of all ages, but children especially experience and express it differently depending on the stage of development. So let's break this down by groups. So we have preschool children, we have elementary school children, and we have middle and high school children. So let's start with the preschool age children. In young children, trauma often shows up in ways that can be easy to overlook or misinterpret. They may fear being separated from parents or caregivers. They cry or scream without a clear reason, or they can lose their appetite or have trouble eating. So these children may not be able to say, I'm scared, but their bodies and behavior tell us something is wrong. For elementary school children at that age group may begin to internalize the trauma, and we might see like guilt or shame, even when the trauma wasn't their fault. They have difficult concentrating in school or at home. They also show changes in the sleep. They also lose interest in activities that they used to enjoy, So they may not talk about their feelings, but they will see, you can see how they react or how they learn and how they relate to the other ones. In middle and high school youth often face some of the most complex trauma responses. And this includes, depression and persistent sadness, self-harm or thoughts of suicide, turning to substance to cope. They also withdraw from family, friends, and school. And something very interesting is they engaging in risky behaviors or becoming more aggressive. At this stage, trauma can dramatically impact a youth person's identity, their sense of safety, and their future choices. So, no matter the age, children do not grow out of trauma, they grow within. That is why early support, trauma, informed care, and safe environment are essential for healing.
When we talk about causes and risk factors for mental health conditions more broadly, genetics can increase your risk of developing a mental health condition. So, like if you have family members who have mental health conditions, but also like life situations can trigger it. Also, like the brain chemistry can impact whether or not you develop a mental illness. Environmental exposures before birth. So, like even if the mom is stressed, is using alcohol or drugs, like or other inflammatory conditions can all impact the baby's like brain development. Adverse childhood experiences are also linked to mental health conditions. Adverse childhood experiences, or ACEs, describe stressful or traumatic events that can happen during childhood, like neglect, abuse, domestic violence, divorce, or living with an individual who experiences a mental health condition. And then stress and trauma can contribute to mental health conditions. Even like brain damage or like traumatic brain injuries, like from a car accident, can be contributing factors. Also, chronic health conditions like diabetes, cancer, or chronic pain can contribute to mental illness, and then substance use can as well. I really liked this quote. Mental illness is not the primary driver of increasing rates of homelessness. So there is a relationship between mental health conditions and homelessness, but mental illness is like not the main reason. When we talk about factors that contribute to homelessness, we mentioned this before earlier in the presentation, but single family zoning laws. So local governments get to designate the laws around like how a parcel of land can be used. And a lot of places it's like designated to only accommodate like a single dwelling for one household, even if like logistically you could create like a smaller house or like a secondary apartment. But that just like reduces the supply of affordable housing. Then like the underfunding of housing subsidies, so like Section 8 housing voucher program, which subsidizes households. So they pay 30% of their income towards housing, and then HUD, the like housing and urban development, pays the rest. However, like there are long wait lists, and then there is discrimination against Section 8 vouchers. There are a lot of places or a lot of like rental apartments or houses that won't accept Section 8 vouchers. And then there are eligibility gaps. So there are people who don't make enough money who do qualify for the housing subsidies, and that's great. But then we have people who don't make enough money to afford their housing, but they make too much money to qualify for like housing subsidies. So there's this like big gap. And then historically, redlining is illegal now, but its impact is still felt today. So redlining started in the 1930s when the government partnered with banks and local agencies to conduct neighborhood appraisals of like investment risk and rated them from A for best to D to dangerous. And then the assessment incorporated race and ethnicity. So neighborhoods that had higher populations of people of color, immigrants, and Jewish residents were considered like those populations were considered detrimental. So redlining neighborhoods like worsened racial segregation, but also contributed to the long-term disinvestment of the neighborhood. So then like people can't afford homes, or just like there isn't the same level of like economic investment into the neighborhood. And so there's been research done that formerly redlined neighborhoods have been found to have higher rates of poverty, lower economic mobility, and lower home ownership and home value. Like we mentioned earlier, obviously employment and wages have a huge factor, but then criminalization is a big one. So the criminalization of homelessness, so like loitering or sleeping in public areas, can then further prevent people from being able to find employment or housing, because there's this kind of new wave of like crime-free housing policies. So like apartment complexes or public housing, they agree to be like crime-free. Um, but then there's like not really a clear definition of what that means. And it basically gives like apartment complexes the power to evict people who have criminal justice involvement. But there's no standard of what is considered criminal justice involvement. So like it could be if you're convicted, but it could also be if you have suspected criminal activities. But overall, it just like contributes to people not having like stable housing. So the relationship between mental health conditions and homelessness is bidirectional. But when we talk about like individual risk factors of both homelessness and mental health conditions, they include serving in the military, lack of social support and connection, history of incarceration, experiencing interpersonal violence, poor physical health or chronic conditions, discrimination and or interpersonal racism. So when we think about like mental health conditions can make it difficult to obtain and like maintain a job. Um, Also, it can mean that like individuals with a mental illness are on like Social Security or disability benefits, which is then like a fixed income, which limits what housing that they can find. Um, and then people with mental health conditions are at a higher risk for eviction. Um, for a number of reasons, but also like some mental health conditions can make it difficult to like just like maintain or like follow whatever rules management might have set, or there might be like paranoia, so you don't trust management to come into your apartment, but then you get fines for not adhering to whatever management wanted you to do, and then ultimately can lead to eviction. And then homelessness. So, like we talked about, criminalization of homelessness, um, chronic stress and trauma can both be like be a cause of homelessness, but also like when you're homeless, you might experience like chronic stress and trauma. Um, and when you are homeless, some people reported that they tend to use substances to help cope with like the memories or like the trauma of being homeless. And so those same things, criminalization, chronic stress, substance use, can also all contribute to mental health conditions. And then individuals who are experiencing homelessness are more likely to have PTSD, schizophrenia, anxiety, depression, and substance use disorder. So trauma can be both a cause and a consequence of homelessness. One study found that 90% of people experiencing homelessness have experienced at least one adverse childhood experience. Um, and then also just the process of losing housing can be traumatic and shocking, um, which could be the trauma of itself. But then when you're homeless, individuals are at an increased risk of being victims of violence and trauma, but can also experience secondary trauma where they witness violence or something happening to somebody else. Um, a systematic review found that individuals who are homeless report feeling shame, hopelessness, shock, and feelings of isolation and detachment. And then like the shame, stigma can all impact an individual's like willingness or ability to seek help or support. But then shelters and like accommodation environments can be dangerous. So put people at higher risk of experiencing violence or just feeling that like chronic stress or trauma. And then its impact on mental health. Some people reported like being in a constant state of fear while they were homeless. Again, experiencing more violence, being victims of crime, that like uncertainty, lacking like personal safety, and then also the like fear or risk for sexual assault contributes to that, to those mental health conditions. And so, like we mentioned before, anxiety, depression, and suicidal ideation are all common in individuals who are homeless. Some reactions that were found in a systematic review is some people just like tend to accept trauma as normal. Um, for people who've been homeless for long periods of time, they just feel like, yep, like trauma is going to happen and like there's no way to avoid it. Um, Kind of a similar feeling with death. A lot of people reported that like they're so used to seeing people die that like their death is inevitable. And for like a small, like a minority of people, some individuals experienced hope, resilience, and optimism towards the future, even while they were homeless.
When we talk about housing security, we also talk about the causes that we present at the beginning of the presentation. We're not just talking about places to sleep. We're talking about stability, health, safety, and the foundation for a child's development. But there are many families that foundation is crumbling. There are enough affordable units available. Families are competing for limited space, and many are forced to live in overcrowded conditions, far from work or in unsafe neighborhoods just to keep a roof over their heads. Wages have not kept up into the cost of living. So rent, groceries, childcare, everything has gone up, but paychecks haven't. Families are spending more than 50% of their incomes on rent alone, which leaves very little for anything else. During the pandemic, emergency measures like eviction moratories, rental assistance, and stimulus check helped families stay afloat. But those supports have ended, and many families who were just getting by are now drowning back in rent and debt. The system meant to help, like public assistance, housing vouchers, and shelters, are overwhelmed and unfunded. So families often fall through the cracks because the support is not consistent, accessible, or trauma informed. So most current solutions are short-term fix. A few months of rental assistance, a one-time subsidy, it helps, yes, but it does not address the root causes. It is like putting a band-aid on the bullet wound. Here is where the conversation needs to go deeper. We're treating housing as an isolated issue, but it's not. It is tied to the racism, poverty, displacement, and general trauma. Without using critical theory, the frameworks that examine power, inequality, and historic context, we keep treating symptoms instead of causes. So when we talk about housing insecurity in families, we have to ask, are we helping them survive or are we helping them to build the future? Because survival is not enough. Families deserve more than that. They deserve stability, dignity, and a place to call home. So let me briefly introduce an organization that's called First 5LA. This is a leading early childhood advocacy and public grant making organization created by Californian voters to invest in Proposition 10 tobacco tax funds in Los Angeles County. In partnership with families, communities, and service providers, First 5LA works to ensure every child in Los Angeles County enters kindergarten ready to succeed in school and life. So this has been proven that this is organization they're working towards this need. So the first 5LA in collaboration with these partners created a trauma-informed approach through Los Angeles County, and they work with the Trauma Resiliency Informed System Change Work Group. They also work with the Parent and Child Interaction Therapy, and the First 5 Lives Permanent Supported Housing Initiative, and the funding training through the United Way Home for Good. So trauma in early childhood have been serious and long-term time effects, especially since 90% of brain development happens by age 5. We cannot ignore how early stress shapes a child's future into adulthood. Unrecognized trauma can have lasting effects, but researchers show early intervention helps build resilience and prevents future risk factors like homelessness. Recognizing how trauma and homelessness are connected is essential creating effective support system for young children and families. So what makes trauma even more challenging is that often goes unrecognized and undressed. A child will not say I'm traumatized, but may act out of school, struggles to focus, and withdraw from others. And if we do not recognize what behind those behaviors, we miss the opportunity to intervene. But there is a hope. Researchers show that early intervention works. Programs like the 5LA support young children and their families, and they're designed through a trauma-informed lens. And this can build resilience, heal emotional wounds, and even prevent future risk factors like chronic homelessness, unemployment, and poor mental health. That is why understanding the connection between trauma and homelessness is so essential. It is not just a social issue, it's a developmental one, a public health one, and a system level issue. If we want a real solution, then the system that serves young children, like early childhood education, healthcare, childcare, and housing, must be trauma informed. Staff need to be trained in the tools and support to recognize the trauma responses with empathy and work in collaboration across sectors. This is not just about services. It's about changing how we see children and families who struggle when we shift from asking what is wrong with them to what happened to them by being and to build system to heal instead of harm.
So a specific population is unaccompanied youth. So they're teens who are homeless without a parent or guardian. Unaccompanied youth are often not connected to services and usually aren't recognized by school personnel. This might be intentionally because they're afraid or they don't want to experience the stigma or shame that's associated with that. They might want independence, so they don't want to go back to their family or the living situation they were in before, or they might be being exploited. So that means that a lot of our data about the number of unaccompanied youth might not be super accurate. Yeah. And then they are also at higher risk for physical and sexual victimization. And often unaccompanied youth are children with marginalized identities, so Black, Indigenous, Hispanic, or Latino students, students who are LGBTQ, or who are experiencing poverty. Homelessness in youth has been associated with lower academic achievement, worse mental health outcomes, alcohol and substance use, and risky behaviors, including risky sexual behaviors.
If we want to move beyond temporary fixes and truly address the root causes of housing insecurity and trauma, our intervention needs to be bold, intentional, and grounded in the right frameworks, like the critical theory informed practice. In this one, we must recognize how systems of powers, inequality, racism, and historical oppression contribute to housing insecurity. A critical theory approach challenges us to look beyond the surface to question the structures that kept certain families marginalized. Empowerment based on social work. This means support families not as a cost to be managed, but as a people with strengths, voices, and rights. Empowerment-based practice focus on self-determination and dignity, not just crisis response. The other one is holistic family-centered service. We cannot separate housing from healthcare, education, or mental health. Families need wrap-up support, service that treat them as a whole units, not insulating problems. Also, the long-term sustainable solutions, like short-term fixes like emergency shelter or temporary subsidized helps, but they aren't enough. We need housing strategies that are stable, permanent, and affordable. so families can plan for future, not just to survive the week. And the community partnership is so important. No single system can do this alone. We need collaboration across schools, clinics, nonprofits, housing providers, and families themselves. Community driven solutions are more responsive and more resilient. And the policy reform, this one change won't happen without systematic policy shifts. That means a strong tenant protection, increased affordable housing development, liable wages, and funding for trauma-informed cares. We have to invest in prevention, not just clean up after the crisis. So real change can happen when we stop asking families to adapt to a broken system and start fixing the system to support healthy, thriving families.
So here are some additional interventions. So these are different like program types. Community health workers are pretty much super important to all of these different types. So intensive case management addresses housing needs, social needs through frequent like non-clinical services and referrals to general medical care, mental health care, substance use treatment. Case managers often interact with clients multiple days a week. They might even accompany clients to meetings or appointments. And this has been shown to improve housing stability, reduces the number of days spent homeless, and improves quality of life overall. Assertive community treatment is using a multidisciplinary team, so including social workers, community health workers, psychiatrists, nurses, substance use specialists, and other staff who assist with housing, employment, transportation, and other social needs. Generally, ACT is long-term and is super flexible and can handle like emergent needs. So there's like 24/7 availability. This has been found to have a significant reduction in homelessness, reduction in hospitalizations and psychiatric symptoms. And it's not necessarily more costly than standard care, and patients are usually more satisfied. Critical time intervention is similar in that it's providing the referrals, the care coordination, and that a lot of that social determinants of health support. But it's like time bound. So it's specifically for people who are in a transition period. So either from like a shelter, hospital, jails, prison, foster care to a community setting. And so it's really high intensity at the beginning and then kind of phases out as the individual like stabilizes. This has also been found to reduce homelessness, increase service engagement, and reduce utilization of emergency services. Permanent supportive housing. So this emphasizes like patient or client autonomy and utilizes a housing first approach, which means that we give people like we provide housing or we get people housed, and it's not a requirement to go through mental health or substance use treatment. Doesn't mean that we people don't have to abstain from substances in order to get housed. But it does use integrated treatment. So like housing, getting people housed, and then providing the support through mental health care or like case management. So this has been found to increase housing rates, increase psychiatric treatment and retention. There was an example from New York City where 88% of individuals in the permanent supportive housing group remained housed after 5 years, whereas the housing that required treatment before they got housed only had a 47% retention rate. And then street medicine. So it is what it sounds like, providing healthcare and social services to people by meeting them where they're at. It's like harm reduction focused and team-based approach. So psychiatrists, substance use disorder specialists, community health workers. So it's providing those treatments like might provide like physical health care in neighborhoods, but also referrals, and then also bringing like basic necessities like food or like tents, things like that. Um, one that's not listed here, but I wanted to mention is supportive employment. So placing and maintaining individuals who have disabilities or mental health conditions, and getting them in jobs that match their capabilities and their preference. So it's really important to prioritize like rapid job placement, so not requiring a bunch of training to do before they get placed, and then really letting them like kind of like pick what they want to do. So taking into account their strengths and preferences. And supportive employment is shown to increase like job acquisition and stability, as well as participation in housing programs, reduced emergency department use, reduced incarceration, and a reduced probability of returning to homelessness. So all of these interventions should be focused on avoiding stigmatization of clients. And it's been found that service providers with lived experience of homelessness have been found particularly effective in connecting with this population. And like I said before, community health workers are essential in these interventions. And so CHWs commonly participate or lead street outreach and like street medicine, patient advocacy and navigation, that coordination between the community and like clinical settings, and then case management. And like I said, like these programs have been shown to be effective, but often they're undermined by a lack of like sustainable funding. All right. So, community health workers and their role and resources for addressing homelessness. So, CHWs are known to show respect, compassion, consistency, and follow through. They demonstrate active listening, patience, and honesty. And some community health workers have lived experience of homelessness, or they're just like they're from the community. So, they do a better job of connecting um, to community members who are experiencing homelessness. Um, which I don't really need to lecture you guys on. I feel like you guys know that. But the challenge is that like there's a lack of affordable housing, and so CHWs can't link people to resources that aren't there. Um, so something I wanted to mention about CHW programs is that it should pay the CHWs a livable wage, allow for flexibility and how they do community outreach, and as well as like their schedules. Programs should be developed with like the CHWs leading it, but also programs should be receptive to feedback from CHWs and change based on what CHWs recommend. Um, and then programs should provide resources and training for like safety, but also like resources so CHWs aren't spending their own money on outreach materials, basic necessities for people, or like they should have work phones or work vehicles so they're not using their own personal work phones and work vehicles, especially like to transport clients between to like appointments. Programs can increase CHW safety in field work by tracking their whereabouts, so like having calendar access or like messaging with a supervisor so somebody knows where they are, or like ideally sending people in teams of two, which then is like less likely when our programs are underfunded. And so that has like an impact on CHW safety. And then we're going to put in the chat, there's an outreach and personal safety training for CHWs that I thought like had some really good resources for the national from the National Association of CHWs. Yeah. So then there's the National Alliance to End Homelessness, which provides information on policies, fact sheets, and tools on learning how to advocate with lawmakers and your community. Then there's the National Coalition for the Homeless, which offers guidance on taking action, and then a leadership academy for individuals with lived experience of homelessness so that they can develop skills to use that experience that they have to advocate for like the homeless community. And then in your community, finding mutual aid organizations and coalitions that focus on addressing homelessness is really important in creating like a stronger community safety net. So a lot of times like our organizations get siloed, whether it's like mutual aid or like more like larger community-based agencies. It's important for us to all work together to like most effectively use the resources that we do have, and just develop a better safety net. Um, And something I wanted to mention is that a lot of times there are housing directories that are like posted online that like accept HUD vouchers, so the Section 8 vouchers, but a lot of times they're not updated. So I always recommend like taking a look at that list before sending it to like a community member because it can be really like discouraging if you send them the list and then they check the first three and none of them either exist anymore or they don't accept Section 8 vouchers. Um, yeah. And then Veterans Affairs hospitals. So if you work with clients who are veterans and they're eligible for care through their local VA, or even if they're like not technically eligible, a lot of times the VA hospitals have resources for homeless veterans. Like we mentioned earlier, the rates of homelessness for veterans is like decreasing, and that's because the VA has it's federally funded, and so they have a ton of resources. So I just encourage people to leverage that if you have community members who are veterans. All right, so that being said, we have some time for questions if anybody has any. All right, so I see Barbara has her hand raised, so I'll go ahead.
Hi. I don't know why my camera is not working, but anyway, yeah, like you said, everything that you said is like, even though doesn't matter where we are, I think the problem is the same, right? Like me, I'm living in Santa Clara County, that I think is the most expensive places to live. And of course, like a CHW, working for a community clinic, yeah, most of the patients that I have, their main need is a stable housing. And and I was trying to type something, but now that I give the opportunities, like really, this is a crisis, no? It's very hard because I've been through that also. It's not just the traumas, it's also the chronic conditions. Part of my work also is provide to education, diabetes management. And I realized that most of the chronic condition is not for the food, it's for the level of stress that they are experiencing, the lack of sleep, and of course the lack of exercise. But yeah, it's very hard for us to do that because like here in California, yes, there is a lot of programs for the patients, but unfortunately, like you mentioned, the resources are very limited, and it's not enough money to be able to help as good as we like to do it. But well, we are here, and I am happy that you have these updates and trainings, and just to be connected with other people from different states. Thank you.
Yeah, thank you so
Thank
much,
you.
Barbara, for sharing. And then I see Estefania has their hand raised.
Yes. Thank you for the opportunity to speak. I want to mention that so I'm calling from California. Many times I've noticed that working in a clinic, in a hospital setting, especially working as a community health worker, there hasn't been enough emphasis on like supporting CHWs in the way that we interact with, for example, with nonprofits, schools, and kind of like doing more for the community. In a sense, like I've have some instances with like leadership, for example, who, sometimes it's just better off just telling patients, for example, that, we're in a crowded system, we're underfunded, like, oh, there's a lack of resources, kind of like putting all the shifting the kind of like the support towards like the broken system in a sense. However, I've noticed like working in partnership with nonprofit organization, being active communication proactively, right, engaged in trying to support patients, even if it's a matter of just like how can we just listen to them? I mean, listening to them, opening the door to that conversation, and kind of like connecting them at the same time with somebody in a nonprofit or other clinic that could in some way make them feel like they're being supported, even if that comes to like completing a housing application, understanding a little bit more what Section 8 is, maybe advocating for parents who have children with autism and they're trying to get into like regional center, for example, here in California, and they're not being heard and they've been calling. Kind of like those little steps is very essential in collaboration with other organizations, as you mentioned. But I feel like in leadership, because they've seen many cases of patients, I feel like they become numb to patients' pain and suffering. And we're just like, okay, we're just going to do this and just focus on doing that. And once you help the patient with one thing, you fit and then just continue to move on, right? Because the demand is so high, and then sometimes we're faced with a lot of referrals to support patients. However, I feel like many times leadership, they're not very intentional in kind of like uplifting CHWs to support patients, especially who are receiving SSI, SSDI benefits, and recently incarcerated. There's not enough support for recently incarcerated people who are on probation, et cetera. I feel like it needs to be more focused, and I feel like leadership needs a lot of training. And even though sometimes the training is there, people just become numb to people's pain or suffering. And I feel like that's where the gaps and the patients fall into the cracks many times.
Yeah, absolutely. Thank you so much for sharing that. And I think that's a great point also because I feel like community health workers are always like going to trainings and like learning more. But then it's like, well, you need like leadership who are supportive or like, well, one, you just like need CHWs and leadership positions, but also that like leadership that listens and like will support those changes or support CHWs. So thank you, everyone. Um, Here is our listserv. So if you want to hear about future presentations, you can scan the QR code or we're going to drop the link in the chat. And then if you have any additional questions, you can email Taylor Dominguez at taylor.dominguez@asu.edu. The recording from this webinar and slides will be sent out before the end of the week. And then, oops. We'd love to hear from you. So when you exit the webinar, a post survey will pop up. And so if you wouldn't mind filling that out, we would really appreciate that. With that, thank you, everyone. And
Everyone.
you have a great rest of your day.